This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hi there, and welcome to the Your Health podcast. So glad to have you along. I'm your host, Shaun McMahon, reminding you that this podcast is available on all your favorite platforms like Google, Apple, Spotify, iHeartRadio, SoundCloud, and more. You can get all the details at cuswestcentral.ca/podcast, and don't forget to subscribe. All right, close your eyes and just think about this for a second. You're in the middle of a global pandemic. You're scared and you're unsure. You also have cancer. The game just changed. Your fears are amplified. What do you do? How do you get the care you need? Well, on this episode of YH, we continue our special COVID-19 coverage, but with a special focus on the collateral damage that could be caused by the coronavirus, if not for some truly remarkable healthcare professionals who are working tirelessly to ensure that oncology patients are getting the care they need and deserve. On the line from the Jewish General Hospital is the Clinical Administrative Coordinator, Oncology and Cardiovascular Services and Co-Director of Operations for the Segal Cancer Center, Erin Cook. Welcome. Thanks for joining me.
Thanks so much for having me.
Oh, it's a pleasure. Erin, as you know, over the last few weeks and months, the entire healthcare system's just been upended. And at the JGH and all over CS West Central Montreal, some really important changes have been made to ensure that patients are getting the necessary and the urgent care that they need. I mean, listen, just this past week alone, I personally know somebody who kicked off a month of radiation. Another friend had a mastectomy. COVID-19 is frightening for the average person, right? Let alone an oncology patient. So what's been the greatest tool you've been able to use so far to help and to reassure all these at-risk patients?
Yeah, thanks for the question. I have to say that we've been really, really fortunate to have access to some of our digital health tools here. So as a response to COVID, we're able to rapidly transition our teams to provide virtual care. So we've now been using mostly the Zoom platform to meet with patients directly in their homes, and up to 70% of our outpatient oncology activities are now running virtually. So the advantage of this is it allows for us to have a visual and even invite family or other caregivers that the patient wants during the appointment. In addition to that, we've been able to put together an educational toolbox for our patients that's available online and answers a lot of their questions and concerns about cancer and COVID. So we're adapting to this new reality.
And that's everybody's had to adapt, right? For healthcare professionals, it really seems like it's just one difficult decision after another during this whole pandemic. Now, in light of the fact that a lot of the non-essential in-person appointments had to be canceled, how do you go about screening patients and ultimately making decisions about what to cancel, what not to cancel? Because, I mean, let's face it, the virus is unpredictable, but so is the progression of cancer in a patient, correct?
Yeah, so I think the question is not who do we cancel, but rather who do we see virtually and how do we make decisions about giving patients the most appropriate care in our current context? So really this decision is made by the entire treating team. So we have virtual weekly meetings in which all the clinicians involved in the patient's case discuss the treatment and the care options available to them. And additionally, for more routine appointments, we simply reflect on the goal of that appointment and whether the same objective can be achieved with the patient through a virtual platform.
It's amazing how digital has played such a huge role in this pandemic for every department. I mean, everybody's had to adjust and use technology to their advantage. I'm curious to know, what are your recommendations for somebody who maybe is concerned but doesn't have a diagnosis or hasn't started the process, but would normally be seeking medical attention, something that they can't necessarily do at the moment in the traditional sense of it? What should they do?
Yeah, honestly, I thank you for this question. It's really appropriate because we're starting to see a trend now in which patients appear to be waiting to seek medical attention for fear of going to the doctors and catching COVID. So I think it's really important that patients know that they should continue to seek medical attention when it's necessary. They can be reassured that before they come to an appointment, all patients are being pre-screened for their COVID risk. And if we determine that it's safe for them to come to the institution, then on arrival, patients are provided with a procedure mask, they're told to wash their hands, and we make sure that they can maintain social distancing within the institution, including any waiting rooms that they may go to. So as long as people continue to practice these key elements, they can be reassured that it's safe to seek medical attention, and it's very wise to do so when it's needed.
Erin, let's talk a little bit about information sharing, if we could, for a sec, because what I'm realizing in talking to everybody is how massively important it's been during this crisis. Tell me a bit more about CCC-19, the COVID Cancer Consortium.
Yeah, so this is a very interesting project. So essentially, it's a group that has gotten together that compiles over 80 cancer centers across North America and other places in the world. And other organizations, they've all come together to collect some data about cancer patients who've been infected with COVID-19. And the intent is to really quickly collect and disseminate information about this especially vulnerable population. And as data continues to be gathered, it's going to help to inform care providers about the best and most appropriate way to manage cancer patients with COVID. It's also going to help us to know where we should focus our research efforts as things progress.
Lastly, Erin, if we could, I'd love to talk about sort of the other aspect, because beyond the medical element of cancer care, there's the support that comes along with it. And CIUS West Central Montreal offers, critical emotional and mental health support for folks throughout various stages of their cancer journeys. So how are our services being maintained, or are they being adjusted and adapted? Is again, this a case of using technology to our advantage? I guess what I'm asking is, can people still find a shoulder to cry on if they need one?
Absolutely. As we're faced with these new challenges, our clinical teams have really stepped up to the plate. Our nursing team has recently launched a virtual clinic for who we found to be our most vulnerable cancer population, which is those who actually caught COVID. So they're able to provide a physical assessment, of course, but mainly the psychosocial support to these patients who are facing their new reality of having a cancer diagnosis, a COVID diagnosis, but additionally being in complete isolation. So the clinic really offers patient education, support, evaluation, and coordination with other virtual care as it's needed. And in addition to our nursing team, we have an amazing team of volunteers, occupational therapists, social workers, pharmacists, and our psychosocial support teams that are following suit and offering other virtual services as well, either through Zoom or other platforms that are coming down the line. So our supportive care has not at all dropped off. In fact, I think they've ramped up trying to find new and creative ways to offer help to these patients.
It's great stuff. Nice that we can learn things and help people who need it the most. There's a lot of vulnerable people at the moment, and it's terrific to hear that they're getting the care and attention that they so desperately need right now. Erin Cook, Clinical Administrative Coordinator, Oncology and Cardiovascular Services, and Co-Director of Operations for the Segal Cancer Center. Thanks so much for being with us. Best of luck going forward, and thanks for all that you do. Really appreciate it.
Thanks a lot, Shaun. Take care.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at ciuswestcentral.ca/podcast or on your favorite podcast platform.